Hello, it's me.
Hello, everyone. Please get out your clickers and turn cell phones off. The attendance code for today is 1738. Hey, what's up? Hello.
It's not working.
It's only 3:59.
If your attendance app doesn't work, sign the sheet after class. Okay, Dr. Whitesock, begin the lecture.
Okay, today's lecture is about personalized medicine. So, what is personalized medicine? Personalized medicine is the tailoring of medical treatment to individual characteristics of each patient. It is about the process of health care provided to the patient, not just about the end state.
So why do you guys think all personalized medicine is important to the patient? Discuss this in your groups.
So how about those chiefs?
It is important to the patients that they can be matched to the best therapy based on their genetic makeup and other predictive factors. Then there is less of a chance of there being serious side effects, and the medication has a higher chance of working. Personalized medicine helps to avoid adverse drug reactions and mutations, helps to determine a better dosage, it improves quality of life, and increases treatment options.
Yeah, it's about providing the right patient with the right drug at the right time. So how does personalized medicine affect translational research? So, Group 6, what's your response?
You got this.
Okay. All right. Well, translational research is turning observations in the lab into interventions that improve the health of the public, right? So translational research encompasses the genomic science that personalized medicine is based on. And without the ability to study the human body on a gene-specific level, personalized medicine wouldn't really carry the same meaning.
Yeah.
I thought that was a perfect answer.
So Dr. Whitesock, does this look different to you?
Nope.
Alright, moving on. So now that we understand how personalized medicine affects translational research, how does it affect pharma? Pharmaceutical companies carry high interest in pharmacogenomics, which is a subset of translational science that uses genetic makeup of an individual to evaluate their relationship with a specific drug or pathway in personalized medicine, to increase profits and reduce costs involved with new drugs.
Yeah, knowing what effect a drug will have on an individual based on their genetics before they even have to be exposed to the drug is a big advantage to research and development sectors. Things are changing. Changing. Okay, so, any questions so far? Okay, then I'll ask one. So, what does this specifically mean for a patient? What criteria is needed for them to acquire a personalized medical plan?
What Dr. Whitesock is getting at is that personalized medicine goes beyond a patient's biology. It encompasses their economic and social status, environment, culture, genome, and even more. The more information that is given to the provider, the more personalized the treatment is going to be for a patient. Questions?
So in theory though, what about the physicians? It's not like they can sit down with every patient for an hour going through every aspect of their life.
Yes, I see your point, but think about how much time it won't waste, because doctors will now have access to know if a patient will have side effects to a certain drug. So rather than possibly having to try multiple drugs before finding one that works, personalized medicine will make that process more efficient.
Okay, yeah, but what about insurance? So all these doctors and patients are going to have all this information about risk factors, but even though insurance companies will still have to cover them, won't they just increase the premiums?
Technically, yes, it is possible. But we also don't know yet, because personalized medicine still hasn't really been put into practice. In a lot of ways, personalized medicine may cause more work for everyone, but it will without a doubt advance our knowledge of diseases and help in more adequate planning for treatment options. Here, we will have some clips from our guest speakers.
So hi, my name is Courtney Barrios. I'm a genetic counselor at Children's Mercy Hospital, and we're here in the Center for Pediatric Genomic Medicine at Children's Mercy. So the genomic technology that we have in our lab actually allows us to look at the whole genome sequence. But a lot of times what we look at when we're trying to find the cause of a genetic disease for a condition is the whole exome, which the exome is all the coding genes. And that usually the reason we look at that is because those genes that are coding for proteins, if there's a change in that, that often causes a more severe effect. And so if we're looking for something that would cause a severe genetic condition, then we would start with the exome and looking at changes in those genes to try to identify the cause.
And
I'm Renee Seamarch, teaching assistant professor with the BHS program at UMKC. Before the FDA issued a cease and desist letter making 23andMe discontinue their services, I used their services and I learned some really interesting information. One of them is that I have 2 copies of a mutant allele that make my body, make it impossible for my body to process a very common blood thinner called Plavix. You could give me all the Plavix in the world and it wouldn't do anything about blood clots. This is information that I shared with my parents because one of them has heart disease and has the possibility of being prescribed a blood thinner, and he needed this information to share with his doctor. Part of what I do at UMKC is to teach epidemiology, and we talk about the importance of genetics when we're looking at the health of populations. It's really important to realize that genes are only part of the story. People can inherit genes that make them more or less likely to have certain, especially chronic illnesses, but the social determinants of health really matter. The diets that people have, the situations that they encounter, all of those affect gene activation and basically how the genes that you have behave. There's a lot that we can do. Genetics aren't your whole destiny.
And
Hey there, welcome to Premier Integrative Health Center for Personalized Medicine. My name is Bradley Dyer, DO, founder here, UMKC alum. Started my career as a hospitalist and have made my transition into personalized medicine here at the center. We were able to create a very personalized plan for you through the use of advanced testing, such as cardiometabolic testing that looks at your lipids on a deeper level, micronutrient testing, comprehensive stool analysis, organic acids testing, all things that paint a really broad physiological map of what's going on that allows us to tailor things specifically for you.
so, to recap, personalized medicine is abruptly approaching in healthcare. As future providers, you need to think about incorporating some of the components we mentioned, learning about the patient's biology, as well as their socioeconomic status, culture, environment, and genome.
Any questions?
Well, the government's corrupt, so it's not going to work.
Okay.
Anyone else? Anyone?
So, what are the takeaways of personalized medicine?
We know that this concept will integrate all components of healthcare from research facilities to administrative facilities and to clinical facilities. No matter what your major is, personalized medicine will affect you, whether or not you're the patient or the provider.
Okay, again class, if your attendance app did not work, please sign the sheet at the front before you leave.